The design of the payment system influences the quality of NHS care for patients in lots of ways. To start with, through the payment system we can make sure commissioning groups pay providers enough money to cover the costs of caring for patients. If commissioners pay providers of NHS services too little, we won't be able to afford to give the high standards of care that patients need and have the right to expect. If commissioners pay too much, we may lose focus on keeping healthcare costs under control. Then we won't get as much care as we could for the amount of taxpayers' money that is being spent. The prices for healthcare agreed through the payment system need to get that balance right. The payment system could also do more to encourage improvements in the way NHS patients are cared for. For instance, if you have a number of health problems, you may need care from several health professionals working together, including your GP. You might also prefer to have as much care as possible given to you at home or in your community, whether from your GP, local community nurse, or social services, so you don't have to face sudden emergencies. Emergency treatment in hospital is costly. So more care for you at home is likely to mean better value for money, as well as better care in the place that you prefer. We need to see more of this kind of joined up working or integrated care to get the best for patients from the NHS budget. This requires social services, primary care and specialist services coordinating their planning and working smoothly together. The payment system rules can do a lot to help that to happen.
Much of the current payment system enables the NHS to deliver high quality, efficient care. However, we hear more and more from NHS providers and commissioners about parts of the system that get in the way of them doing their best for patients. Everyone thinks there is potential for the payment system to do a much better job. That said, the NHS price list proposed for the 14-15 National Tariff Payment System is much the same as last year's. This is because we don't want to make big changes to the payment system on top of all of the other change going on at the moment in the NHS. That could be very disruptive and make it difficult for commissioners and providers to plan for the year ahead. Also, we don't yet have all the evidence we need to redesign the payment system in a way we can be sure is helpful. We need more details from providers about their costs and from patients, doctors and nurses about the quality of NHS care. Gathering this evidence takes time and involves us working closely with health professionals, all types of care providers, commissioners, patient groups and health charities. Our first set of proposals for the national tariff would also make the rules for setting prices for services that don't appear in the price list both clearer and more flexible. Commissioners and providers would have more freedom to arrange payments differently, as long as that they can demonstrate that any new arrangements will benefit patients. We're doing this largely because we know that commissioners and providers sometimes found the old rules a barrier to designing services they believe would serve patients better. In return for this greater freedom, we would be asking commissioners and providers to tell us exactly how they are arranging payments for NHS services and the expected benefits for patients. Giving us this information, along with the other evidence we are gathering, would help to ensure that we make really sensible changes to the payment system in future.